And good morning, everybody. It's our Shed, the Shed Group, MedicareHelpGuys.com, MedicareHelpGuys.com. What do you do, folks? You go over to the website. And hey, if you want a free consultation, sign up for a free consultation. But most importantly, folks, we want you to take the quiz. Take the quiz. If you take the quiz, that gives yourself and us a good bird's eye view as to where you will fall when it comes to retirement healthcare spending. Folks, remember, retirement healthcare spending is not just what you spend for Medicare. It is also the items not covered by Medicare, which generally turns out to be 10 times more expensive than what you will spend in the Medicare space. So you take the quiz, it provides us with a score. That score allows us to look at the averages as they pertain to you, and we craft a plan accordingly as to how it will look and feel for you in your environment. Everyone's situation is different, right? So it's not a one size fits all. Everyone's situation is different. So we have to pay attention to those things. It's not necessary for you to go out and purchase that long-term care policy at the age of 40, right? And spend over $200,000 for it. And then at the end of the day, in certain cases, you have people today who are purchase these lifetime benefits or 5-year benefits and are only able to utilize 1 or 2 years because the agreements have been revised, right? How many people have received a notification from Genworth that said that the long-term care policy that they have, which is for 5 years, they're going to cut back to 2 years, or they're going to cut back to 1 year, or they give you the option to take a cash payout. They don't want to pay. And the reason why they don't want to pay is because planning for retirement health care is kind of a daunting task. And in the case of long-term care and the actuarials who put them together, they were hedging on certain things that didn't necessarily materialize. So anyway, we want you to take the quiz. Take the quiz, and we'll put together a strategy for you and your family. Remember, we're not only protecting your assets, we're also protecting your income because it's our job to isolate the retirement health care spending. All right, that being said, folks, that's the commercial. Hey, we want to do a video today. It's not going to be long, but it's about UnitedHealthcare and why UnitedHealthcare. So I'm going to play the video now, and we'll discuss some of the finer points on the other side. So let's get right into it.
I was the first to turn Medicare age.
And I had that benefit that you signed up first. When I aged into Medicare, it was a very easy process because Charlene had gone through it already. But we sat down and talked about it and made sure that my doctors were in the network and drug coverage was going to be good. And it was very simple then. I can't remember when I didn't have UnitedHealthcare.
UnitedHealthcare is honored to shape the Medicare experience for millions, including our family and friends.
Okay, so there you have it. Brad and Charlene chose UnitedHealthcare. They probably chose UnitedHealthcare for 3 solid reasons. I mean, we did hear that they obviously have a Medicare Advantage product. He was talking about networks and talking about his prescription drugs, right? They chose a Medicare Advantage environment that's stable. That's UnitedHealthcare. Why do I say they're stable? Well, I mean, it's a large environment. It's it meets that test of law of large numbers. There are, if you check the Google Gemini rankings, they tell you that UnitedHealthcare, over 9 million people, or 28% of people in the Medicare space, have a Medicare Advantage plan through UnitedHealthcare. Next, below that would be Humana, CVS, and then Anthem. And if you're looking at the Medicare supplement side, it's again a very stable environment. UnitedHealthcare has 32% of the Medicare supplement environment. And then you got Mutual, Omaha, and CVS, and the like. So look, this is the United Healthcare environment, again, is a very stable environment, a very practical environment, a very reliable environment. So it puts a lot of your ease, or angst, I should say, puts a lot of the angst that you may have at rest. All right. And that's what you want, right? In the Medicare space, you don't want to really be worried and thinking so hard about Medicare when you're looking at your carrier and what they may be doing. UnitedHealthcare is just a very stable environment. You can take that issue off the table, and it will allow you to focus on those other items that at the top of this video that you need to be aware of. The things in the healthcare space that will wreck your retirement have nothing in most cases to do with Medicare. It's the items that Medicare will not cover. Now keep that part in mind, folks. And that's it today. I'm not here to belabor you a whole lot. I want to try to keep these as short as possible. Just enough information for you to kind of walk away with an understanding that, hey, look, you got somebody who's got your back. I got your back. I got your back. I know what's happening in this environment, and I know how testy and daunting it can be, but we're here to help. The Shed Group and the Medicare Help Guys. One website, www.medicarehelpguys.com. Go there, take the quiz, get an evaluation. Let's talk about the things you need to be thinking about when you think about retirement health care spending. Folks, that's all we have for today. Hope you enjoyed, and we, of course, look forward to doing the next video.